Welcome back to Wellness Wednesdays here at Spine and Rehab Specialists. I'm Earl Hayden. I'm one of the physical therapists here. Again, here with me is Chris. He's going to help me demonstrate some exercises. So last week we talked about the hip hinge, specifically the single leg deadlift, and now I want to talk about just doing a regular deadlift because this is a movement we do every day. We try and just pick up things from the ground. So we're going to use a kettlebell to learn how to do the deadlift. So we have this bell right here. You notice how Chris is lined up. The bell is right here. We're kind of right between the forefoot, right by his forefoot. It's not too far in the front, it's not too far in the back. So what he's going to do, we're going to do a standard hip hinge. He's going to push the hips back and then bend the knees. So we push back and bend, okay? And he's just tapping the handles of the kettlebell, just getting used to the technique, okay? So if we aren't comfortable with that movement, it sets us up for a lot of problems later on down the line. So once you're comfortable with just tapping the handles, then you can go into actually lifting up the weights. So here we go. Chris is going to go down and he's going to grip and pick up the bell. If done properly, the bell should tap the exact same spot every single time. It shouldn't be drifting too far to the front or too far to the back. If it's drifting to the front, typically you're not pushing the hips back, you're not keeping the back muscles nice and tight to help stabilize the spine. So this is a good movement to get strong with making the back a little bit more resilient, getting stronger and being able to handle bending over with load, which is something we do on an everyday basis. And now we're going to do deadlifts again, but now we're just using a crate. So again, this is a movement we do on an almost daily basis. So if you can master with the kettlebell, one thing you can do is to use different shaped objects. In this case, we're using a crate. So Chris is just going to do the same setup, getting close, gripping those handles nice and tight, pushing the hips back and bending at the knees, okay? So you notice he's not looking too far down. He's not cranking up on the neck. He's just kind of keeping everything fairly straight, okay? And this is really good. Notice how he pushes the hips back and the knees just kind of follow, okay? And that's how you do a standard deadlift. Again, this is just a simple movement we do every day just to pick up things from the ground, but it's also good exercise to get strong with to build up the strength in the back, because sometimes if we're having problems with still bending over and trying to do daily things, probably this is something we just have to practice a little bit more. But as long as you have good technique, you can gradually build up the strength there, and then you should find that you just have less irritation with doing daily activities. If you're still having problems with that movement though, maybe it's time to go see a physical therapist. You can come by over here. Again, join us over here at Spine and Rehab Specialists. We can do a free screening and come check you out and see how we can get you moving. And again, join us every Wednesday for another set of exercises to keep you moving.